Round on this rainy Tuesday afternoon. We apologize for the delay in starting. It's mainly because of the rain. But I'm glad that you're here for us to talk about demon spirits or mental illness. We live in a setting where mental health is something very strange to many individuals. We have a lot of people who have a strong belief in traditional medicine. We also have a group of individuals who also have very strong beliefs into religious beliefs, and we also have a group of people who mix the two. So they are strongly religious. They'll go to church and do everything that the church requires, but then in their homes or at other times they're going to go and be doing other things with the traditional healers or practice witchcraft and things like that. And then we as the medical profession come as individuals who want to talk about mental illness. And many times we are going to have arguments with them as to whether this is traditional illness or actually a disease that can be treated by a modern doctor. So we wanted to throw light on these conditions that are very rather common, you would say, in our communities, so that you get a better understanding on the condition. My name is Associate Prof. Noeli Nakasuja. I'm Chair for the Department of Psychiatry. So I wanted to give you a few slides, about 3 or 4 slides, to paint a general picture of some of these disorders that usually are mixed up and are hard for you to diagnose, especially when you're dealing with accidents and emergencies, because a couple of these individuals are going to be brought there as people who are dying, and you have to sort them out as quickly as you can. The first I want to talk about is the hyperventilation syndrome. I believe most of you have seen people who are brought in, usually casualty, and they are breathing, they can't catch their breath, people think they are about to die, or something has happened to them. But when you do investigations, you're going to find that there's nothing physically wrong with either their chest or their metabolic function. The hyperventilation syndrome, which is also called psychogenic dyspnea, is common as a presenting symptom for patients who might have panic disorder. It also is common in patients that have agoraphobia, but it can also manifest in patients that have conversion disorder, which I'll talk about in a short while, and so can it manifest in people who have dissociative disorder. Okay? So the hyperventilation syndrome per se is not a diagnosis, it's just a syndrome. The other bit is the conversion disorder. A conversion disorder is a psychiatric disorder that results with neurological complaints. So in the DSM-5, it's also called a functional neurological disorder, because an individual is going to present with neurological symptoms, either motoric or sensoric, for which you cannot find a neurological explanation. For example, they may tell you, I have numbness on the left side of my body. Or they will tell you, my hand can't move, okay? Or it is stuck in this position. I recently saw a young girl who is in Form 6. She has a problem. She initially started complaining of back pain, but then that back pain now went into her hand, which became paralyzed and she couldn't use it at all. They started doing physio with the hand, and then it started functioning. But then she remained with dysfunction in these 2 fingers and the thumb. Is that neurologically possible? Is it possible? So she walks into the room holding a laptop. And then we talk, and then she says, but I can't use my hand. I practice writing with my left hand, because she's right-handed. So she can't write anything at the moment. So she uses her left hand to write, which handwriting you cannot learn to use in E6 when you have exams coming very soon, because they're doing finals very soon, in about 2 months' time. And then as she picks up the laptop, the rest of the hand is functioning very well. And then I noticed these 2 hands are like stuck together, like this, but the others can be able to move around. So when you get these patients, you do a proper neurological examination so that you're sure that the impairment that they are purporting to have may actually not be as they are expressing it. Conversion disorder also presents a lot with pseudo seizures, collapse, fainting, and it has been known as hysteria old term. If you've heard about it, I think you've heard about children in schools barking like dogs, moving like, you know, on their feet. You've heard these things in the story, in the newspapers? No? Yes. Yeah. Well, they are very common, okay? Usually it is something that arises in a stressful situation. There was a situation in northern Uganda where a certain school, all the students kind of ran amok, they were shouting around, they would have to run and pick them from the forest. Do you remember that story? That was about a year ago. It's because there was a conflict between the headmistress and someone else who wanted to take the school land, and you know, the headmistresses talked to their kids and everyone got so concerned as to where they're going to study, at whatever level they had reached, if they had to be moved to anywhere else. Okay? So usually there's a stressor. The other one is factitious disorder, or what we call Munchausen syndrome. Factitious disorder is a condition where a person intentionally produces symptoms just for the sake of being in the sick role. Okay? So usually they disturb medical personnel a lot because they are going to be coming to whatever it is that you may be working, complaining of a certain impairment in their functioning, but they are only doing it for the sake of being in the sick role. That's all they are gaining from it. They feel happy that, you know, I'm confusing you a lot. And usually they're going to come and tell you all kinds of things because they've learned all the investigations, they know the medical jargon, and, you know, you'll be kind of destabilized with this patient who seems to know so much about, you know, medical terms and things like that. But these patients are only doing it because they just like to be in the sick role. The sick role is being ill, people looking after you, you know, being in that condition. So the care they receive from the medical personnel who attends to them, or if at all it's his relatives, the concern that they are showing towards their being unwell is all the benefit that they are getting out of it. Okay? And then we have Munchausen syndrome by proxy. In this one, the symptoms are exaggerated or fabricated in another. Usually it's going to be in a child. So usually it's mothers who are doing it to their children. So the mother does something to the child so that they can have certain symptoms they can present with to the hospital, so that the medical personnel can run around and flit around in trying to manage this child. About maybe 8 months ago, I read one of where the lady was always causing electrolyte imbalance in the child. How? She was giving the young boy salt, so much salt that he would get, you know, hyponatremia. I think he eventually died because she would repeat it. They would correct it. She goes home and then still does the same thing. You correct it and then, you know, still she does the same to the child. So it is seen as a form of child abuse, though usually, of course, the mother has issues and that's why she's doing this kind of thing. So when you get to managing her, there's putting her in prison, but then there's also managing her mentally, because she certainly is not doing this out of a good mental functioning. And then there is the malingering. I think you've all heard about malingering. Malingering is when individuals intentionally fake or create symptoms for secondary gain. So, for example, if I have certain symptoms and I know I'll be excused from doing a certain activity, I'll fake those symptoms. I may decide, you know, maybe my hand, it can't write, I'll be excused from doing a certain paper, or I will be given extra time. So sometimes these things, when you start with one of the disorders, the others can keep on coming in. So now, like this girl I was talking to you about, because she can't write with her right hand, she's given extra time, an extra 1 hour per exam because of inability. So she has secondary gain. She has more time to read the questions and be able to answer in good time. Okay, though that wasn't the primary problem that she had in the beginning. Okay, sometimes people don't want to go to work and they fake symptoms. They may come to you as medical personnel. Doctor, I don't know, I have headache. This headache is really funny, and they describe it in ways that you can't even, find in the textbook, because they want you to write them days off. Maybe they have a gig somewhere or something which they need to be present at, and yet they can't say that at their place of work. So they feign some symptoms so that you can write them off. Okay, so in summary, the conversion disorder, it is unintentional. The symptoms that are produced are unintentional. It is because there is an underlying psychological distress, and that is why the individual is presenting to you. In factitious disorder, the production of the symptoms is intentional, and there is a primary gain, in which case, in this case being emotional, the patient themselves are the ones that are benefiting from just the attention that comes from being ill. And then there is malingering, which is intentional, but it is because of a secondary gain. There's something else they want to do for themselves, but not primarily because they want to be ill. So today, we are going to talk about dissociative identity disorder. I wanted to speak about these first so that we put them out of the way, so that you do not get confused as to what it is we're going to talk about. So we have a panel of discussants this afternoon. We have Dr. Hilary Irimaso, a second year postgraduate in psychiatry, who will give us the case. And then we'll have Dr. Nambusi Najiwa, who will tell us about the etiology and pathophysiology. Then Dr. Letitia Tohangire will tell us about the clinical presentation. And then Dr. Janet Nachigude, a psychologist, will tell us about the management of these disorders. They will each present for about 15 to 20 minutes. I'll give you the timing. So you're welcome to this presentation.